I think the less anxiety and the sleep are the biggest things because they affect all of our lives.
It was a consult with Dr. Rebecca Rodersheimer, Leanne says, that led her to consider Botox bladder therapy.
I think the less anxiety and the sleep are the biggest things because they affect all of our lives.
So Botox is indicated for overactive bladder. So overactive bladder is kind of a constellation of symptoms, the main one being urinary urgency.
After years of never wanting to be far from a restroom, Dr. Rodersheimer, a female pelvic medicine specialist here at Ohio's Urology Group, told Leanne when other methods of treatment have failed, an outpatient procedure to inject the Botox is all that's needed to sort of interrupt the signaling between the brain and the bladder.
There are nerves that talk to the bladder muscle, and when those nerves talk to the bladder muscle, there's a neurotransmitter that gets released that causes the bladder muscle to spasm. And when the bladder spasms, that causes that urgency symptom. And so the Botox kind of blocks the communication between the nerves and the muscle.
You know, I noticed it within 2 days.
Well, there are possible complications.
One of the kind of most feared side effects is it can cause retention.
Leanne says she's not had any problems with her series of one-time shots. It's a relief, she says, not to need the restroom as often, especially overnight.
I'm just thrilled to death with it.
Now, this therapy lasts for about 6 months. It is used in both men and women, and in most cases, it's covered by your medical insurance plan.
You can always find our stories here on YouTube, but go ahead and click subscribe to get notifications and stay in the know.